I have been involved in this program from its inception many years ago. And when I think back, it seems like yesterday. And it reminds me of a story of my wife's grandmother when she stood up at her 100th birthday party and gave a speech. And she started the speech out and said, "Man, that first 100 years went quick." And really, this program, it's gone quick. It seems like yesterday that we were sitting out in the trailer in the back at UBC of the sports medicine clinic there, trying to come up with a concept and a design to sort of bring practitioners together. And I have to say that I think this program that Wendy put together, and I love her passion for it, and I think her passion has kept it going very strong. But this program has really brought all the practitioners together in a very sort of dedicated, common goal program. And so when we go out and do the athlete screening, it's really a group of people working together in one thing, and that is to give the athlete a tool to allow them to be not only a better athlete, but a healthier athlete. And one that hopefully when they get through with their career, they don't look back and say, it wasn't worth it because I can't walk across the street now. And so I really enjoy this program. I enjoy being involved with the physicians and the kinesiologists and the chiropractors and the nutritionists and all these different people, because they all are there for that same reason. So when we get together, we have an opportunity to do early recognition, and we have an opportunity to do intervention. In the process of going through the screen, they're really simple things. Wendy did an amazing job in putting it together in a flow, so that we start with a standing posture, we sit down and do some rotational stuff, we sit down and do some flexibility testing and range of motion. But in the end, it's the message we give back to them that's important. How do we incorporate that message with the screening that means something to the athlete? And being able to talk to the athlete about their sport is very helpful for sure. But over the years, I found that you can sit there and you can look at the athlete and you can be looking at their knees and their feet, and you can sort of make a comment like, "Do you get low back pain?" "Yeah, how'd you know?" And you say, "Well, it's very common because you've seen all of these things and the people like this." And so that, and after a while, the athlete kind of appreciates this person has an understanding of my body, not just my sport, but my body. And they sort of buy into that information package. So we go through this screening with the athlete, and then in the end, we usually end up giving some comments. Now, this is an overall comment, the type of thing we would put together after doing a team. I've done soccer, I've done gymnastics, I've done cycling, I've done golf, I've done swimming, I've done rugby, I've done wrestling. All of these different sports, and it's quite interesting. I'll go through a little bit more in the end. When you've done a group of them, you find there's some commonality in the types of things you're going to see in this sport. And just imagine a short track speed skater. What do you think they all look like? They've got this one arm back and this other arm out, and they come in and they stand here like this in the clinic as they assess me. So sports have inherent things built into them. But the overall comments, I think, and like Wendy pointed out, being able to have the coach involvement have been the most fulfilling and successful groups I've worked with. You run into some groups where the coach just doesn't want to, I don't want to be told anything. I know about coaching. And you run into other groups and they sit there and they say, that makes real sense now. Now I understand, like Wendy pointed out, why that athlete or why this group of athletes has trouble taking some of my information I'm trying to tell them to do, but they can't do it. And they think there's that breakdown there, but physically the athlete is having some troubles. To give you a story on that, on an individual level, I had a woman who rode horses, and the coach was always on her about her posture, but her posture, when she'd try and sit up straight and get into that position, sit up straight, pull your shoulders back, sit up straight, pull your shoulders back, the horse would veer one direction. And the problem was that she had a pelvic alignment problem, so that when she'd get square and sit up, try on the horse, one leg would be veering into the chest wall of the horse, and the horse would be reacting to that pressure. So they're always trying to make the horse go the way it should go, and the horse is reacting to this little pressure. And once it was pointed out that you've got these sort of postural things that we picked up in the screen, and your pelvis is rotated, which means you're going to sit like this if you're upright square here, and if you're upright square here, you're going to be sitting over here like this. It made sense to both the athlete and the coach. That's our problem. It's not the communication between you and I. It's the fact that your body is out of alignment. Rick Hansen had the same problem when he started his wheel man in motion. When he had his fusion in his spine, he has a slight rotation. And he spent so many hours getting so far behind on his tour trying to get the bucket in his wheelchair square. When the bucket was square, his shoulder would be off, and he'd get a tendinopathy in the shoulder. Then he'd yell at him to fix the bucket because it's not right, until finally they figured it out, and they got a sling that where he could just hang there and wouldn't be fixed in his position. The overall comments to the teams for this 205, this was a soccer team. Concussions. 5 of these athletes have had head injuries, and 1 has had 3 with at least 1 severe and 2 mild. 2 have had neck injuries. So these are things that going then with Anthony or going with the strength and conditioning program, that they could introduce probably some strengthening protocols for these people to get their necks in better shape, and things in conclusion or in conjunction with us and the suggestions that we give. These are the valuable things that come out. For the individual athlete, here's the kind of thing that you would get on the report backward. They have a forward head position, poor mid and lower traps control. So it may relate to the complaint of ongoing neck complaints. They were given quadriceps, hamstrings, and Achilles stretching. Their needs are they need posture, mid-trap, and intermediate core work. So this is the kind of thing that comes back on each individual athlete. The athlete as well would be given a specific quadriceps stretching program. They'd be giving their calf stretching program or something, usually 3 or 4 drills to work on. They're very simple. Most of the time they require no extra equipment other than a piece of elastic tubing, so that they have something that they can work on. And if the parents are there for certain age groups, it really is helpful to have them involved in the process. What I find also with the parents is you try and make it that it's the athlete's responsibility, it's not the parent's responsibility. They're only there to get information so they understand what it is that the athlete is talking about. The athlete has to take responsibility for it. If the parents try and get in there and say, you got to go do these, you got to go do these, it's probably never going to work out. We also get a chance to look at unattended injuries, and many of these people come through and they'll have seen a lot of injuries occur and they will not have had them attended to. We get a chance to intervene, assess, and give some direction on what they need to do to look after these injuries. We get a chance to look at chronic injuries and what is it in their program or their lifestyle or whatever it is that may be leading to these chronic injuries. They get management suggestions. They may include warm-up, strength training, bracing, stretching, or referral to other consultants or other professionals in their area to sort of deal with this. And that's one of the things now that the program, most of these suggestions will all go to Darcy. Darcy now will be filtering them out to those individuals in the area to try that she'll be working with to get these athletes looked after, which I think is a better step in the program. Instead of us individually recommending the athletes, I think it's better now to go back through Darcy, and then she can control this direction of where the athlete can go or should go, and we probably will get better follow-up, which is what Wendy talked about. That's always been a little glitch of making sure that there's some follow-up with these athletes in the programs. One of the things that's become very evident, and I don't want to spend too much time sort of emphasizing it because Rob's going to talk a great deal about, but more and more and more as I go through this program, posture becomes the issue of getting these athletes into an athletic posture. The best thing that I can see when an athlete walks in the room, do they have good posture? This is going to be a breeze. Unless they've got an acute injury where somebody's hit them or tripped them or whatever. But if they walk in with good posture, you can almost say that 95% of your job is already done. They're not going to have all of these chronic sort of problems that you run into. I clipped these pictures out, and this is just an example of where posture makes a huge difference, and just the subtle differences in Tiger's address of the ball and the alignment. And just looking at where the center of gravity, where the club falls, where his head space is, where his alignment, all of those things are issues that athletes and coaches need to be sort of familiar with. When I was going through looking for posture and head position, I ran across the picture of Scott Colley, who posture is so important, and in the young athlete, and I think if we can get the coach and the athlete involved and the training and all these things in terms of what posture can do. On this here, I'm sure many of you are familiar with, Big Country. He is one of the athletes who I think, had somebody been able to work with him when he was receptive in his young training career, his athletic performance, he was one of those athletes who was gifted and good in terms of size, and he could shoot, and he was able to exist a long time on that. If somebody could have worked with him when he was younger in terms of head position, alignment, he was a 7'1" guy who played at 6'10". He had a 2.5-inch leg length difference that nobody ever addressed. So when he walked, he looked like he had cerebral palsy, but that's because one leg was so long and one was so short, he had to adapt, and he had this really strange gait that people would look at him and think, hey, he looks like, you know. If somebody could have worked with him earlier on in his career when he would have been receptive to a change, he would have been a far more outstanding athlete. He was good, and he was able to make a lot of money on what he could do at that point. But posture, it really destroyed his career. He ended up with a low back problem. He ended up with chronic knee problems and all kinds of things. This is what posture does. It changes the image. It changes the presentation. It changes people's awareness. And so looking at that round shoulder, head forward position when we do the assessments is very important. It's quite interesting when the practitioners get together at the end. We all have a different sort of way of looking at it, but generally speaking, we all come up with problems in the same area. They all have had neck problems, they've had ongoing shoulder problems. On one side, they've got a head forward position, they've got a round forward position, they have really tight external rotation or limited internal rotation of the shoulder. It all comes together in a picture. The alignment of the pelvis, we're looking at this, and we probably don't do as great a job on it right now, but it's one of the areas on the assessment forms that we've looked at of trying to pick that up more, because sometimes we look very good at the sort of side position, upright position, but looking at them straight on, they may have a tilt in their pelvis, and they may have a true short leg, or they may not. But a lot of the alignment issues that come up are really just adaptive things. Most of our sports are played with a right hand dominant presentation and a right hand dominance carrying out of the sport, so you end up with these acquired changes in your alignment, these acquired pelvic things. So the athlete may come into you and they have one shoulder higher and they're standing there and they have one pelvis forward, and for golfers this is really quite intriguing that, you know, they lose their backswing, but they've got all their power and stuff and going so much in one direction that it's very simple to change, actually. And for these athletes, if you can give them a couple simple things so that they can manage this before and after their training session, makes a huge difference on chronic low back, medial knee pains, foot and ankle pain. This thing keeps getting... The chronic complaints that you'll see with postural problems is hamstring pulls, patellofemoral, SI joint, ankle, and foot. And over my career, I think you could go back and look at most textbooks, I was taught to treat each one of these things as a specific area. So somebody came in with a hamstring pull, I directed all my attention at the hamstring. If they came in with patellofemoral, I directed all my attention at the kneecap. If they came in with low back, I looked at that low back. I never looked at the athlete as a whole in my training program. Every now and then it was sort of, you know, addressed a little bit. But in all the textbooks, you know, everything's listed under, here's a knee problem. So you read that, tells you what to do for the knee. But it doesn't tie the knee into the whole issue. Why do they have the knee problem? Particularly in chronic issues. And more I go to it's, you know, their alignment somewhere is out. What they're doing repetitively is being done, just like my car when it's out of alignment. I wear the tires out and I can keep changing the tires, but the problem's there until I correct the alignment. So in the session, or this is one of the sessions we did this in Kamloops, I think it was. Going through and looking at alignment, pelvic alignment. Really there's this the testing program is so simple that it's almost baffling when you first look at it. And a lot of practitioners, when I go in and do these sessions to train other practitioners, they kind of at first are almost a little like, well, geez, this is not really very thorough. I've taken all these upper quadrant courses and I've taken all these, manual therapy courses. Honestly, I just say follow through with it, and you're going to find it's an amazing tool if you just follow through with it. It works so well. This is a picture of an athlete who actually looking at pelvic alignment and low back rotation. I just usually take a hockey stick and lay on there. You can see how much rotation to that hockey stick on the lung. And with 2 minutes of work and learning how to unrotate themselves, because they're usually fairly mobile and flexible, you can get quite a change in the position of that low back. I don't know if this will go backwards or not. That's okay. Looking at the feet, looking at pronation and supination and how it ties into it, many times the foot is, again, looked at as just, well, you've got pronation on one side and supination on the other, and so we need to get a pair of orthotics. But maybe they have a central problem where they've got some rotation and they've got a chronic, and so one foot, the body always tries to keep your center of gravity neutral, and it's going to do a lot of funny things to do that. So we do look at their shoes, look at the pronation. I do really think the marriage of the orthotic with the shoe is so important, and it's not done very well anymore. I think the shoe industry is one of the biggest difficulties. They have come up with this concept, well, if we only make a neutral shoe, they'll get orthotics and we don't have to make anything to stabilize the orthotic then. So they take the orthotic and it's like building a foundation for a nice house on a swamp. It's going to sooner or later sink. After you've gone through the assessment, then you go through and teach the athletes some appropriate techniques for whatever little problems they might have. So we spend a little bit of time maybe looking, in this case here, probably a tight hip flexor, and trying to teach the athlete the importance of positioning when you do these. Many times they're doing things sometimes to address them, and if you ask them to demonstrate what they're doing, they just need better awareness and control and understanding of their body position, even in doing the adaptive exercises, is extremely important. So when you go through these programs, and these are samples of some of the athletes and some of the suggestions over the years that I've sort of put together. So the athlete number 3, they needed upper body, lower, and mid-trap strengthening given. Lower body, quadriceps, hamstrings, and hip flexor stretching was given. I would guess this athlete probably had poor posture when they came in. They probably had round shoulders and a forward head. Athlete 4, upper body needs general shoulder strengthening. If you can't sort of sort this out now, you see almost all the athletes come in, the ones that need problems, they're like this. They have that forward head. They have a poor sense of awareness of where they should be in space. I'm not going to spend a lot of time on this. One of the things is the core testing, strength versus timing, and Wendy and I had a little discussion on this, and I think she told me a story, one of her athletes came through and we went through this, and it's a very simple test of looking at whether or not they can hold core stability when they do alternate leg lifting from this position, and if they can bridge and do alternate leg lifting, if whether or not the pelvis drops and falls. You can see a lot of athletes who have extremely good core, but very poor timing. And so what happens is I always compare it to skiing. When you learn to ski, you watch your ski tips, and your reaction time is too slow, and so you fall. As you get better at skiing, you look down the mountain, you program what needs to be done, and never really think about it anymore. And core training is really a lot for athletes to hold a neutral position. It's not about doing crunches and sit-ups and millions of things so that you get a strong core. It's about being able to use what's there in an appropriate manner. I maintain that you could never have to do a core exercise if you did all of your other strength training programs in a good neutral posture, and you didn't lose that neutral posture as you went through your training program. You would be teaching the core how it has to work, and that is to be able to transfer force from the ground through the trunk to the arm, or from the arm through the trunk to the floor, whatever it is. It is a transition point. It is not the initiator of push-off. It is a transition point. And so teaching people that there's a difference between just absolute strength and timing and being able to use that is demonstrated very well in this program, because some of these people, the athlete, Wendy said, well, you didn't test my true strength. I've been doing all of these things. What she was looking at is the ability to control that neutral position and make sure that it engages quickly and doesn't allow that little drop. A lot of people, it'll engage, but what happens is it engages a microsecond too late, and that's it. Then you've lost position. You start to try and compensate to hold that position. This is, I was looking at what, core exercises, pictures. And this was rated one of the best core exercises, and it was recently granted the official personal trainer's seal of approval. And I'm thinking, what a bunch of crap. Like, tell me an athlete who this is a functional program that's going to teach them anything about body posture, position, and being able to hold that athletic position. In the summaries of teams, this is in October 08, female basketball, forward head position and round shoulders. Generally, that was the common theme throughout the whole group. And if you think of a bunch of young girls playing basketball, and particularly the taller ones, they have a lot of issues with this. And I really think that this is where the coaching staff, if they buy into, they can do a world of good for these athletes. They can make good athletes great athletes if they really tell them, try and think of a great athlete that has bad posture. I don't think it happens. You can see a lot of good athletes that have crappy posture, but great athletes usually work from that really centered position. They know where their body is in space. March 06, short track skating, general comments. It's worth noting that 6 out of 10 athletes assessed had a history of concussion, all had pelvic and spinal rotations, primarily right anterior rotation, that direction of power movement. January 05, softball overall impression. As a group, they need to work on posture and body awareness and posterior shoulder strengthening. All these exercise programs, strength and stretch, should be done from the neutral posture positions. So those are the kind of summaries that we would go through and work, and then talk about some little programs, even with coaches, that they could interject. A lot of this can be done in the training program. So when they're running bases or they're receiving ground balls, you make them work from a good neutral posture position, not a slouch head forward, sort of out of balance position.